Hi, my name is Dr. Ecker of Allegheny Physical Medicine, and the topic of discussion today is the shoulder. There's a lot of different conditions that can occur with the shoulder depending on the type of injury. As you can take a look at this model right here, you have three muscles. You have the supraspinatus, infraspinatus, and subscapularis muscle. And basically they make, in the teres minor, they make up the cuff. That's why they call it the rotator cuff, not the rotor cuff. A lot of people say that. And then you also have another common musculature problem would be the biceps tendon, which is bicipital tendinitis. And through the interview process and an examination, I'm able to determine which problem and condition that the patient has. One other thing that I'd like to mention is the most common area of shoulder misalignment would be an anterior-inferior misalignment, also known as a subluxation. And that's what chiropractic treats. Once you have that misalignment in the shoulder, what I specifically do is just to give a little adjustment to that area, and that creates a little bit of motion, which will get rid of the pressure and the pain. So the second part of the, after the interview with a patient, I have them go through a couple ranges of motion and muscle testing so we can test specifically to find out what the problem is. One of the most common areas that we have them do, it would be just to reach back, so have the patient reach back and then see their motion and then see if they have any pain, and then you have them come back this way, and is there any pain or discomfort, and if there is, then that would be indicative that it could possibly be a rotator cuff problem or a shoulder subluxation. And then from that process you just go into a couple muscle testing where you have the patient push up, and that would be more for the supraspinatus musculature, and then you have them rotate down, push down, and then back, so that you're checking the internal and external rotators of the shoulder muscles. Once you diagnose that problem, what you can do is you're going to strengthen the weak muscles and stretch out the tight muscles. And depending on what other conditions that can occur in the shoulder is osteoarthritis, and then once again we'll do a little bit of musculature work, mobilization, adjustment of the shoulder, and then we recommend a couple other things. Sometimes we use a tuna omega-3 fish oil, which is the right combination of DHA to EPA, and then a glucosamine synergy, which not only has glucosamine, but it has manganese, flaxseed, carbamide, and calcium lactate in there. So it's just a whole complex that works really well with osteoarthritis and certain shoulder conditions. Thank you for attending the session, and we'll see you next week, and we'll be talking about the elbow.